I think it's probably time to kick off. Good afternoon and welcome. And welcome for joining us in the second of a series of webinars. If only I could see your faces. We've got now 452 people attending. I'm sure I'll recognize a few, but unfortunately I can't see you all, but welcome in any case, and welcome to all the new attendees. It's really nice to have you on board, and I really hope you enjoy today's session. My name is Lani Uys. I'm one of the product managers here at SpaceNet Global Group, who's also kindly sponsoring this afternoon's webinar with the support, of course, from EZMed and from Medici. Just a reminder that you will receive one ethics CEU point, kindly sponsored by SpaceNet Global Group as well, provided that you did give us your council number when you registered. Guys, so last week we kicked off the webinar series and it was an amazing response. We spoke about how to navigate telehealth in your practice. We looked at a checklist, what you need to look out for when you choose a telehealth platform to provide your virtual consultations to your patients. And we also addressed some of the malpractice insurance issues, specifically relating to telehealth. Like I said, the response was overwhelming and we had a long list of questions. So what we did for you, we compiled all the questions, we added all the answers from the three panelists, and we actually uploaded that document together with the link of the webinar on the EZMed.solutions website, and it's under the webinar tab. So just go back to the past telehealth webinar, I think it was the 21st of May, if I'm not mistaken, and you will get all the information there. What you also asked for, you ask, we deliver, is a checklist, and that checklist is freely available for you to download on the landing page. So just look for the big tag that says checklist, and you'll find it there. Hopefully you find it very, very helpful. Now, probably one of the questions that came asked most often during and after the webinar last week was, which telehealth platform, give me a name, should I be using that is secure, that is functional, that is provider friendly, that is patient friendly, but where I can also still bill my medical scheme? Now, guys, to answer this question and to address this, we arranged a very, very special demonstration, which is coming up this Tuesday, that's the 2nd of June, at 4 p.m., where we're literally going to show you a live demonstration of the integration between EZMed, your mobile, intelligent, and very, very easy to use private and practitioner practice management platform, as well as Medici, which is your secure virtual telehealth platform. And we're going to showcase how those two integrate. It's the first time ever in South Africa that this is happening, and it's definitely not something that you should miss out on. You can register on the webinar tab. Look out for next week's Tuesday's date, the 2nd of June, and that's at 4 p.m., same time as today. So where are we today? I think we're standing on day 63, if I'm not mistaken, since lockdown started. And that list of uncertainties is just growing. We know the whole country should be going down to level 3 come this first Monday, 1st of June. Some of the hotspots, maybe it's going to stay level 4, maybe not. We know some of the churches are going to open, maybe some of them is going to stay closed. I think it's completely up to them. The schools should be opening, but what's going to happen to our kids' education? I'm sure you've seen a lot of people who, from a mental health point of view, have been affected by this, and I can put my hand up. I'm definitely suffering from a bit of sort of virus anxiety, if I can call it that. So the list of uncertainties is growing, both at home as well as in the business, and I'm sure in your practices and even in some of the hospitals that you're working in. But one thing that's not uncertain is how COVID is going to affect us now, tomorrow, in the future, and all the after effects of COVID. That to me is definitely not uncertain. COVID is here to stay. And especially the way that you've been treating your patients as a healthcare provider, I think that has changed as well. And I think the way that it changed, that's here to stay as well. I need to introduce to you two forward thinkers. They both look and try to look beyond COVID-19 and not just get bogged down on the day-to-day issues that we're dealing with. But before I introduce them, please note, they're going to share their opinions. This is an extremely dynamic environment. Things change at the pace of lightning sometimes. So they're going to try and give you the facts, the figures, the most up-to-date rules, regulations, and acts. But bear with if some of the regulatory bodies are updating an act or a rule as we speak. First of all, I think you all know Deon Buhrs. who is extremely passionate about providing technology solutions to healthcare professionals in South Africa. Deon, as you know, is also Director of ProfNet and the SpaceNet Global Group Executive for Operations. Now, Deon, like myself, believe it or not, we're both physiotherapists by training. And this actually put Deon in an extremely ideal position to create, design, develop, and deliver ProfNet's flagship practice and patient management solution, EZMed. Also on the line with us today again, Neil Kinsley, welcome. Neil is absolutely no stranger to the telehealth environment. He's the CEO of Medici Africa, and he's also the founding and the governing member of the Digital Health Association of South Africa. So today's topic, the future-proofing of your practice post-COVID-19, trust me, is right up their alley. And Deon, please can I ask you, do you want to start and just try and paint me a picture of what the healthcare environment is going to look like post-COVID? I mean, surely with Monday coming and we're all going down hopefully to level 3, surely we can get rid of telehealth at least.
Thanks, Lani, and good afternoon to everyone. It's really great having you guys on board. We limited our number of delegates today to 1,000, and we're really close to approaching that. And we trust that you'll all be here next week again on Thursday, and that you'll ask your colleagues to join us as well. Hello to, I see quite a few leaders within the associations and societies. Haley, I recognize you there. Sylvia, thanks for joining us as well. Yeah, welcome to all of you. I think what is important is that people are constantly asking, how much do I invest? Both from a systems point of view, a processes point of view. We all know change is difficult. I think we're all experiencing this. The 63 days has certainly been a lesson in change management. But do I invest in this? Because surely COVID's going to be done. We're going to see the aftermath of it behind us, and we're going to carry on as usual. This is obviously something that's very close to us because we need to decide as well as a business and as partners, are we going to go into this and invest in something that may not be required in the future? And I think categorically we have to look at two parts. Firstly, what's happening internationally and also what's happening locally in South Africa. We can't just translate international trends and think that just because it's happening like that in the US, it's going to happen the same way here in South Africa. But we can learn lessons from them. And I think Neil has been quite close to a lot of practitioners in the US. And their journey of telehealth and telemedicine. But what I can say is, somebody coined it earlier in a meeting I had. With his permission, Sam said I can quote him on this. So I'll give him the acknowledgement for it. But he said, we're not looking at a post-COVID world. We're looking at a post-spike world. And that already started resetting that in my own mind. I think it's very well said. We got a spike. I don't think we've seen the top of it. The Minister of Health himself has said we need to brace ourselves for a massive surge. They're already looking at whether the Western Cape has got enough beds, and I think the quote is 1,200 bed shortage in the Western Cape as we approach the surge and the spike in South Africa. We've got winter coming, so we've still got a long way to go, Lani. I think just because we're going to level 3 doesn't mean that the patients out there are now suddenly going to say, I'm more than happy to walk into any space. You've seen people already reticent. You bump into friends or family and you're kind of going in for the handshake and you suddenly realize you can't, and the mask is back up again when you're going for a run or a cycle. Yeah. And so people are very different in how they're approaching social engagements. Why would you unnecessarily expose yourself to risk? We're looking at solutions on how we manage virtual waiting rooms. Because just going to a doctor and sitting in the waiting room with other patients there, you're going to find the public saying, is there not an alternative? This is just about Johnny, and I just want to have a look at the cold symptoms, and should I be getting something or a repeat script? There's so many other ways of doing this, and this has really been an interesting time to catalyze both the practitioner and the patients out there, our clients, into exploring areas that they may not have explored before, because it's been, again, about change management. And they've suddenly realized the technology is there. It is appropriate and effective. I mean, here we are sitting talking to 517 people around the country and possibly around the world. And the technology is serving us very well. If our hand wasn't forced in this, perhaps we would still be having contact meetings and talking to 30 people about this. So it's moved us into a space that we're not just going to quickly click the undo button and think we're back to normal. Prof. Karim heads up the ministerial task team to advise the Minister of Health on the corona crisis. And I was really moved by, I'll close with this quote that he put out. And he said, this was in a webinar about 3 weeks ago. I'm not sure if other guys had attended that. It was facilitated by Discovery. But he closed by saying, not just now for the COVID crisis, but even post-COVID and post-spike, life's not going to be the same. We're going to have to find different ways of shaking hands. We have to find those alternatives. It's going to be a change for good. He said that the days of grandparents and grandchildren hugging is something that we have to rethink about. Now, Corona is not going to just disappear.
It chills down my spine when you say that.
Yeah. I think it's an extreme position, but I mean, this is from Prof. Karim himself. And it also got me to recalibrate my own thinking to say, it's not going to be the what are they calling it? The old new, or the new old, the new past is not going to be happening post-spike. I think we're going to be looking at things differently. And I think telehealth is just another tool to help you reach out to those patients and provide the services complementary to your current services.
Perfect.
No, I mean, if you don't mind, let me weigh in. I think you're 100% right. In actual fact, I have to tell you, I think we're sort of beyond the question now as to whether, telehealth is still going to be around post-COVID-19. For me, the question is not, is telehealth still going to be around? I think it is actually, how are we going to use telehealth? I think we're beyond that now. And if you just look, the time is right for it. And in fact, COVID-19 pushed telemedicine into the fore. There was a bit of a scramble. A lot of people went to try and find which platform were they going to use. For the first time, they got to learn what end-to-end encryption was. Then they started to feel around and just to get some idea of what they needed to use, etc. But the reality is that people still get sick normally. Telehealth was being used for the day-to-day stuff, the eye infections. And I mean, I had a situation, as Deon knew, I actually, my doctor actually used telemedicine to show me how to take a stitch out, so people were still getting sick. Now they've become used to it. And here's another thing, you can't expect that people to jump on, they've been using WhatsApp and they've been emailing their practitioners for so long. Now you come along and change into a more formalized platform. They're not going to jump on in the first 2 or 3 weeks. And I see a couple of practitioners out there, they've been using it for sort of maybe even 60 days. And then they say, well, my patients don't want to use it, and they give it up. That you've actually got to persevere with it. But the time is right. A really interesting thing is, Lani, you mentioned about behavioral practitioners. One of the biggest spikes that we've seen in usage is around behavioral practitioners. Psychologists, psychiatrists have been using telemedicine. By far, probably one of the greatest usages, certainly on our platform. And it's been really interesting because, in fact, I must tell you, one of the psychologists that had been using telemedicine long before COVID-19, she was telling me the other day that the fact that she was able to text her patients had become invaluable to her because of the fact that not only did she have a lot of existing patients, but there were now a lot of new patients because of lockdown, etc. And she had seen an increase in gender-based violence in her practice. And being able to text her patients in private and not having to rely solely on a video platform was invaluable to her. So, these are the things that are happening out there today, because telehealth has been great for COVID-19, but it's been even better just being able to extend care to patients on a day-to-day basis. Right. I think I mentioned last week to you, I mean, we have seen practitioners that have had no disruption to their revenue at all. Not at all.
That's amazing.
So the time is so right at the moment.
But Neil, talking about revenue, you read in the newspapers and you hear everywhere that especially the medical schemes, a lot of them are pumping in, I'm talking millions of rands, into their specific telehealth platforms. Does that mean, if you say the healthcare providers that you're aware of that didn't take a financial dip, are they getting money from the medical schemes? And do you think that will continue now that we're going into level 3 or level 2 even?
So, I mean, that's such a great question. In fact, somebody posted a question that on last week's chat line, and I said that was one of the best questions, and it was, will medical aids continue to pay post-COVID-19? And if not, is it worth going through all the trouble? Well, actually, medical aids paid for virtual care long before COVID-19 came into place. Some of the forward-thinking medical schemes out there already had platforms in place. A Discovery, Dr. Connect, BankMed, probably at least 18 months ago, if not more, brought out communication to say that they would pay for virtual care under certain circumstances. ProfMed did the same thing. MMI did the same thing. So there were some, medical schemes were already doing it. But you know what has happened, which I think has been fantastic for the clinical world, is that in the last sort of 2 months, two things have happened. And this is also why I have a very strong belief that telemedicine is going to be around for a lot longer. Yeah. First of all, there's a lot more certainty around remuneration and around coding. All the medical schemes right now have brought out some kind of clarity in terms of what they will pay and what codes are required. And I think Deon will talk a little bit more about that as well. But there's a lot more clarity about that. Probably a year ago, it was probably difficult for a practitioner to say, well, I'm going to embrace this fully into my practice, because you never really knew how much you might be paid, by which medical fund. It's a lot more clear now. That's the one thing that's happened. The other thing, of course, is that the relaxation of the regulations, and I do put in for now, has just made it so much easier. It's just made it a lot more acceptable for a practitioner and a patient to be able to communicate on a virtual platform. Yeah. So there are just so many things, the stars have aligned, if you like, and it's just made it so easy for practitioners to use telemedicine. Yeah. And those that have embraced it, we have just seen the most amazing examples of telemedicine. We have a lot of dermatologists on our platform, and one of them said to me about a week ago, "This has saved my practice. It's kept me going. I'm able to extend the care that I probably could not have."
What a testimony!
And
that's amazing.
Absolutely, there's intention to carry this on into the future. So I think we're beyond the question.
Yeah, Neil, I think coming in there, I attended an interesting webinar yesterday, just understanding the US experience around telehealth and also their billing structures and processes. And we'll bring it back to home in a minute when we go into the medical schemes and coding. But a couple of things that came out from that is that Blue Cross, for example, has undertaken that they will continue funding telehealth going forwards in the US. And some of the things that are coming out of that space is things like somebody stating telemedicine has had its chance to shine, and it's done that. I think that's important for us as healthcare practitioners. As we embrace this, let's make sure we do this appropriately, where it's required for the patient, and handle it responsibly. Because the HPCSA, as one, Allied HPCSA, the Social Work Council, they're all looking at this space going, this is new. We recognize our regulation is old. It needs to be redone. They had to do it very quickly for COVID. But I think post-COVID, or let's say post-spike, they're not going to, they said they will revisit their position, not roll it back. And that revisiting needs to be done. We're also making the assumption that when people are saying, is there a place for telehealth post-COVID or post-spike? My question is, was there a place for telehealth before the spike, before COVID? And absolutely there was. And telemedicine was starting to pick up a nice groundswell. There's even a regulation from the HPCSA that's 5-6 years old around telemedicine. So they've already come to the party in that. And I think that is going to be reviewed in our current new norm. The technology has always been there. It's been the, who's adopting this? What is the patient experience and what is the practitioner experience? We've been resistant to change. We've been given a reason to change. And I think after the spike, people are going to look back and go, okay, quickly push the reset button. They're going to go, actually, this worked for me. Most certainly, I think our platform for training is going to be webinars. We're not going to just push the reset button because COVID, we're past the spike. We're going to embrace what has worked for us in this time, and it's certainly working for many practices, as you say.
Deon, you don't think there's a chance that the regulatory bodies are going to push this telehealth genie back into the bottle after lockdown?
I don't see it. I think we can't predict it. I don't think we can say for sure. I know I'm on record here, but there's certainly been a lot of engagements. Neil, you guys have been engaged as the digital healthcare platform and association, engaging with the HPCSA. I think what we have noticed is they've been open for communication and engagement. They have realized that this is working. We're demonstrating that it's working. The patients are giving positive reviews on it, and they would have to reassess that also in the light of accessibility and affordability of healthcare. We are now embracing technology to bring healthcare to corners of the world that didn't have access to these before. So it's going to be quite a hard sell to say we've had a litmus test of it. The catalyst has pushed us into this space. The technology is there to support it, and it's been used responsibly and appropriately. I think there might be regulation around something that was quite interesting that came out from the US as well, was that Medicare is looking at telehealth most certainly as the way forwards, but they're saying home being the originating site is a concern. And so do we have our practices where you've got a home visit, and you might go out to do that. You've got hospital rooms services, you've got outpatient services, and you've got telehealth services. And that's formalized in a space. And I think, Lani, you've got some interesting plans for future webinars around how do I make sure that my home environment is actually correct and appropriate, so that when I am engaging, it's quite professional. I don't know, Lani, if you want to talk a little bit about that, but that's quite exciting.
Not yet. You have to wait until the end. Deon, but both you and Neil said the conversion from a healthcare provider side to really embrace the technology, embrace telehealth, that's there, and we're getting there. And I think people are really using it. But there's a really interesting question that came from Helen, and Helen, I'll keep your surname anonymous at the moment. My difficulty, and this is her question, has been converting my patient's mindset to agree to telehealth. Do you have any tips that we can share with them?
Well, Neil, you love the example of SMSing, right?
No, absolutely, because I mean, we get that often. I really battle to get my patients to embrace telehealth. And yet, very next day, they'll SMS you or WhatsApp you or email you, which actually is telehealth. It's just a different form of telehealth. And I have a theory on this, and I'll tell you what my theory is. And my theory is that if you are using only a video platform, I think we make the assumption that every patient is comfortable to put themselves onto a live video screen and stream themselves over to their practitioner. We found that definitely not to be the case at all. In actual fact, if we look at the amount of text consultations that happen around the world, they by far outnumber video.
Yeah.
So I think when you're only offering a video, I think that it's perfect. It's fine for sort of when you might have an initial consultation, or it might be it might be a follow-up on something where you need to be able to see each other. But I think where the patient wants to just check in and just say, that you worked on my muscle yesterday, it's not right. It's something not feeling right. And sometimes they just need a little bit of reassurance. Yeah. This is just by far the easiest way to do that. And that's why WhatsApp is used so much, because it's easy. It's so simple and so easy. And I think that's why patients do it, that they have been so used to SMSing and WhatsApping you.
Now, Neil.
And of course, the unfortunate thing about WhatsApping is that there's an expectation of not being paid.
Yeah, but there's expectation also of being immediately helped, isn't it? When those two blue ticks come up, I know you've seen it. And why you're not responding to me? Not rude.
Yeah, exactly.
Neil, you've gone down a route here. Yeah,
and that's the thing. You've gone down a route, and you've taken your patients down that route, and they've learned that. And it's hard to get out of that. And I'll tell you what, if I look at the practitioners that have embraced, they've actually had to be, I guess, a little assertive. And the best way I think that I've seen doctors handle it, that the practitioner will say to their patient, I am very happy to deal with you in a virtual environment. But there's certain risks involved with this. And they're risks to me and my practice. And all I ask is that help me to make sure that I'm compliant. Help me to make sure that this doesn't become a subject of a litigation for me later. And I sort of think that any patient that ignores that and is not prepared to go on board with you based on that probably shouldn't be your patient.
Now, Neil, I think what ties in very nicely here, and your feed is glitching a little bit, but we're catching you there. But Pamela Hansford says there in the chat, and it's very interesting, is that the benefits of COVID is that it's catapulted us into using telehealth, and whether it is SMS or email or WhatsApp or formalized systems and processes like Medici, I think that alternative forms of engagement are there and they are being used. But one of the things so I'll give you maybe a chance just to think about that while I just make the next point, is you've gone down the route of WhatsApp. I'd like you to, when I'm done the next point, just speak to the most recent SAMJ the SA Medical Journal's article on WhatsApp, because I think that's those who are keeping close to the regulation and the views in South Africa will want to maybe just expand on that. But before we go there, if we're using these various elements, and being a clinical practitioner myself, I hope some of you guys can share this experience. Maybe I'm exposing myself here, but if I treat a patient and 4 years later, I get a call from a medical scheme or the patient or somebody just inquiring about that intervention, and they say, listen, you saw John Smith 4 years ago. I start thinking, John Smith, I can't actually remember seeing that patient, but let me go to my clinical notes. And then I open it up and I go, Brachis, I actually did see this patient and I saw them for 2 months. So my clinical notes are crucial for me, because otherwise I can't remind myself about who I saw, what was the complaints, and what treatment was done. But worse still is when you reach for that clinical file and you pull it out and you go, actually remember this patient, but I'm very sure I sent him those exercises in an attachment. Maybe it was on email. Then I go to my email sent items of 4 years ago and I hope to find it there, and it's not there either. I'm thinking, okay, was it a WhatsApp then, or was it an SMS? And I start running around in all these different channels going, I'm very sure I sent this, but I don't know through which channel. And I think that's one of the risks of embracing various systems. We need to be harmonizing those. As Pamela says, how do we bring that and optimize the process? I want to be able to, as a practitioner, go to my practice management system and say, you say it's John Smith. Here's John Smith's record. Let me quickly see, yes, 4 years ago, I sent him this SMS on that day. This email went out then. This telehealth consultation happened then. I sent the claim to him here. We called him about the credit control notes then. It's all in one place. If we're not able to do that, we're exposing ourselves, not just because of a discomfort of not being able to find these communications, but also medico-legally, we're putting ourselves at risk. And it's because of bringing all of that together that underwriters are excited to soften the costs, the additional excesses payable when you've got a harmonized system like EZMed and Medici bringing all of that into one place. But now I'm going to put you on the spot about that WhatsApp article.
I mean, I thought it was I don't know how many people saw it, but it was such a great piece of research. It was a research piece actually. And it really dealt with WhatsApp in the clinical environment. It didn't really deal so much with the one-on-one WhatsApp, but rather with a group. And if you haven't seen it, you'll find it on the web somewhere. And I'm sure we could post it, but it was really, really good. And what they looked at, I mean, let's just take a step back on WhatsApp. You know, what we did a bit of research about 2 years ago, and we found that probably 8 out of 10 doctors were using WhatsApp because it's so easy to use. But it's also a frustration to doctors because there are a couple of things. First of all, you've got to give away your cell number, first of all, or you've got to hold a second number. That's the first thing. Second of all, you can't take yourself offline. As you've said, Deon, you're available 24 hours a day, unless you put your phone on. You know, you can see when your doctor's read it, and then the patient expects you to be, there's an expectation of no revenue very often out of it. You can't export that into a practice management system of some type. I mean, your point is so good. You know, what happens if you're subject to an audit sort of 6 months down the line? Then you've used something where you don't have some kind of objective third-party mechanism that has been able to record and say, well, this is the date, the time, and how long this took. You know, besides your own notes. I mean, you may find yourself in a pickle. So WhatsApp, but it's so easy to use. So the article actually dealt with WhatsApp and how to use it in a group environment, and it was really interesting because it puts a massive amount of liability certainly on the administrator. And one of the points that was so important in it is that once you've posted something onto that WhatsApp group, it's actually noted in terms of law as being published, therefore open to everybody, which now means you're now subject to the Publications Act. So there are so many things around, and so many important things that you need to know about, and regulatory matters that you need to know about it before you start using WhatsApp. And one of the things I've got to tell you, I think the TeleHealth group on Facebook, TeleHealth South Africa, that on the Facebook, that comes up quite often. And one of the points that they make so well is that check with your liability provider, make sure that you are covered, because that's probably one of the best ways to know whether something is compliant or is at a greater risk or not. But those are the problems with WhatsApp. And honestly, if you're able to find yourself a platform that is as easy but takes yourself offline, makes you anonymous, allows for that texting. Why would you not use that rather than a WhatsApp environment?
So Neil, now Nelfrey is asking exactly that question. She's a podiatrist, understand, Nelfrey. And Nelfrey's saying, but I've got my WhatsApp on my laptop, so I can actually, I don't have to use my phone. Now your phone has to obviously be paired with that, and the patient needs to know what your personal cell phone number is so they can do the WhatsApp. But Nelfrey, I think it is important that you're able to, in one place, do all that comms. I mean, I love the fact that I can answer WhatsApps and see something's coming through while I'm answering emails. And you're asking directly, the question is, can the Medici app be downloaded on your laptop? So certainly for the healthcare provider, Neil, you can have it as a web browser, a web app on your computer, and on your phone as well, on a tablet, whatever else. Yeah.
Absolutely.
Yeah, you can. You know, there's another point I want to make, and that is just since the time, just in the last 2 months, if we look at what's happened in telemedicine, the technology has grown in leaps and bounds, and that is just going to continue. I was looking at an article just this morning about Google and Apple that have now come together to collaborate to put a track and trace system into place. So basically what they're trying to do is identify somebody who may have been in contact with a COVID-19 patient, and then using certain algorithms, they were then able to predict areas that would be infected before it even happened, breakout areas. This is the kind of technology that's happening out there. And we've already seen it's not even new, but we've already seen stethoscopes, glucometers, etc., that are all remote. This technology, the video technology, the texting technology, the data security, it's all going to get better as time goes on.
It's not going to regress, it's only going to progress.
Absolutely. Do you remember when you got your first cell phone? I mean, I remember
the brick.
My first cell phone. It was like about this big, and I had to pull the aerial out the top, and most of the time it dropped calls. Today, it's an integral part of my life. Telemedicine is undoubtedly on exactly the same.
Absolutely. And Neil, I'm sure that's why you're also so part of the Digital Health Association of South Africa. And maybe you can just give us a bit of input. What are they doing with regards to telehealth? Is there an update from their side? And I actually want to tie it in, and I've got a post-it note here from a very interesting comment that we actually received. And the comment read, telehealth is extremely valuable in the rural areas, especially in the public sector. And it will be absolutely great if the National Department of Health can consider telehealth an acceptable form of delivery. Are you guys addressing that, or what is happening in the public space?
So the Digital Healthcare Association was established about 18 months ago with interested parties in the environment. Myself and a number of other entities that we're all involved in this. And I mean, our first and foremost, we were looking to self-regulate the environment. That was the first thing, so that we had some kind of standard towards the kind of solutions that were put out there, just to help the practitioners. Because, to be fair, 2 months ago, there were probably 4 or 5 choices. Now, there are probably 25, with a whole bunch more coming. I mean, every day on Facebook, I'm getting bombarded with video platforms from all over the place, from Russia and Germany and all over and they're all free, and they're going to do this and that. And
all of a sudden, everyone's a specialist.
Absolutely. And they're going to be the next solution. So what we were trying to do is to help the practitioner to take a path to try and help them, to show them what they should look at. That was the one thing. And the other thing was to try and just to self-regulate and say, if you're going to be part of this association, data security, ease of use, practitioner first, these were all the things that needed to be in place. One of the things we did as well, though, we spent a lot of time and a lot of intellect putting guidelines into place. So we put the Digital Healthcare Association of South Africa guidelines into place, which is quite a comprehensive document that both solutions and practitioners could look to for some kind of guidance. This was actually, we had quite a lot of intervention with the South African Medical Association just before the regulatory changes, who had taken those guidelines on. So we were quite instrumental in getting a lot of those changes made. And post-COVID, and right now, we are still doing it. So we will continue to lobby, we'll continue to support, and we'll continue to put out good information.
Lani, can I come in there just on that question about the rural areas? I just want to loop it back to that question. I think it's a great question because it talks about accessibility and affordability of healthcare, and it's been ranked. I see you guys have voted those up. So on the question and answers, you can actually vote them, and if you like them, it pushes it to the top, so we can prioritize those. So feel free to do that in the Q&A section. But the point being is that telehealth is not just about the connection between the practitioner and the patient that we've journeyed in over the last 63 days as the different regulators and councils have come on board to address COVID, to open it up for that. And then not just to established patients, but also to new patients. So that's the great progress we've made over the last very short time. But telehealth and telemedicine is also from practitioner to practitioner. So in the rural areas, I think where the great value sits, and I've seen it in the US as well, school-based telehealth, is that you have a nurse, a primary healthcare nurse in an area, or you've seen the numbers of community healthcare workers that have been mobilized. That really excites me. I think the number was 40,000 have been mobilized to do testing. Now you can imagine community healthcare workers, primary healthcare nurses and so on in these far-flung areas that are calling in for advice and support. You as the occupational therapist have done a wheelchair setup for somebody, and they've been discharged back home. It's quite a rural area. There's bumps and knocks on the chair and it needs to be reviewed. To get that wheelchair and person back into public transport all the way back to the clinic or the practice, and that can be done through community healthcare workers dialing in and saying, listen, this is what it looks like. Here's a text, here's a manual, here's a message that's going through. This is the video sharing. I think that support and reaching out to those spaces is valuable. The National Department of Health embracing telehealth, I think, is crucial. Most certainly should play a fundamental role in the national health insurance plans and that going forwards. I think we can most certainly leverage much more healthcare through strained resources that way. It's a smart way to deliver healthcare. So we fully support that. I think rest assured that as a SpaceNet Global Group, we do engage on public sector platforms as well, not just private sector. So we have and will continue to engage there to see what solution we can bring to that space.
So Deon, apart from just rural areas, there's a couple of questions that came in. Can local healthcare providers use telehealth with international patients sitting across borders in other countries?
So we covered a bit of that last week, and I'll just update again there, and then perhaps we can go into the billing and the medical scheme side of things. So I think that's also quite a burning issue for the delegates. And that is that provided, and this sits in the booklet 10 at the HPCSA, and the allied HPCSA also has a clarity on this point, is that if you are providing it across border, you as a healthcare provider must be registered in both the country or the region that you're providing the services from, as well as in the region that the patient is in. So if you were consulting and doing a psychology assessment or a psychology intervention with a patient sitting in London and you sitting here in Pretoria, you'd have to be registered with the UK authority as well as the HPCSA.
Okay. Thanks for just thanks for that update.
Shall we go into, I think, some of the medical scheme side of things?
Please do. You wanted to start talking about that? While Neil's dog is entertaining us.
Good reflexes there.
Someone goes talking about
some things you can't control, eh? Hey, Batman. Guys, there is a comment that came up there in the stream, and somebody's just saying that's Sohana, and we appreciate that. We really did, and we want to continue to have this as a casual conversation type of interaction. This is not a lecture or academic exercise. So thank you for reflecting that back. We try and make it as friendly and easygoing as possible. And we'll try and respond to you guys, and let's have a date every Thursday at 4 o'clock to have these conversations. I'm most certainly relaxing. The last time I had a jacket, and I've now got something a little bit more informal to wear, so that we can just ease into this. But it is about conversation.
So guys, I had to think about whether I was going to tell you this or not.
Idea.
There's going to be somebody on here that says, no, that was staged. But as I've been sitting here, my phone is sitting here on the table in front of me. And I alluded a little bit earlier to my doctor who had shown me via telemedicine on how to take a stitch out. He has literally sent me a message, there it is, I don't think you can see it, asking me, how's it going? Just checking. That is telemedicine. I mean, that is telemedicine, right? He's just done it. So, and that is just, he's just checking in just to find out, am I okay? That cementing of that relationship between practitioner and patient.
Amazing.
It's just fantastic.
And now, Neil, can he claim for that from the medical scheme if it's appropriate?
No. I mean, it's literally, it took him 2 seconds to say, Neil, how is your foot?
Okay.
You know, he's not going to claim for it. He's just checking in to see if I'm okay.
But with your previous engagement you had with him, when he taught you how to take out a stitch?
Yes, he did. Yes.
Okay.
Yes, it was a consultation. Yeah. So the interesting thing about that consultation was that I originally reached out to him on the virtual platform, and he said to me, "You need to come in. You need, you know." But the thing about it was that by the time I got to see him, he already knew what my problem was.
Yeah.
So it cut down on the time. You know,
Yeah.
he did have to he had to do a bit of work, put in a stitch. And then, you know, he then showed me via video how to take a stitch out, which was easy to do. I took a photograph. He could see that I did fine. And he's just checking in to see if I'm okay. I mean, that's just so great.
Yeah.
And that's what
can you follow that up, that text up with a video or a photograph of your stitch and where the wound was and send it to him to have a look and tell you, but I think you need to come in, that stitch came out too soon or it looks infected.
Absolutely. And that's exactly why, that's exactly what happened. And that's why he's, you know, checking in to see if I'm okay. I'll just follow up now and just say, hey, I'm all good. I'm feeling good. In fact, I'm ready to start running again. So I'm feeling good. And, you know, he's checking it. And there's just something more to it. There's no financial gain for him, but it's reinventing that patient-practitioner relationship.
But what's important here, Neil, is that was done on his terms. So it's not an invasion on his personal private life where you're sending a message at 9 o'clock at night going, something's not like he can actually set his consultation hours and when he's available, and also what his response time is, that he's going to take 10 minutes to get back to you or 2 hours, so that the patient also knows what to expect and when a formal professional engagement can happen. It's not a welcome to my life and my personal life and you can ask me whatever you want, whenever you want. Right?
Absolutely. And honestly, I think that if I was using WhatsApp with him, I don't think that I would have the same kind of thing with him because this is on his terms. It's not on my terms as the patient.
And you would probably think twice about sharing your video or a photo, a screenshot, or
sure,
because that's saved on his device.
Absolutely.
You wanted to talk more about the medical schemes and payment and what they're paying for or not.
Sure. Yeah, I think I see we've got 15 minutes and maybe while I go through this, we can pick up some of the top Q&As, but I'm going to give just some of the principles I think that do apply. I think firstly, people are saying, are medical aids paying for it and will they pay for it in the future? Well, again, I want to go with what happened before March this year. Before March this year, medical schemes were paying for telemedicine. In the appropriate right discipline, in the right place, with the right technology, they're paying for telemedicine before COVID. So, of course, they'll continue that afterwards and possibly even more so. In the GP space, they were paying 2/3 of the face-to-face consultation fees for telemedicine before COVID. In COVID, they're paying 75%, and I think that'll continue going forwards. Discovery, I think a lot of schemes turn to Discovery to kind of guide them. I want to quote a letter that went out to all the allied healthcare professionals, or they're calling it the AT&P professionals. And here at the bottom, and it's very important, we trust that these changes will support healthcare professionals in delivering care to patients. This is now the payment for virtual care during the stressful time and post this period. That's their specific words. And that this will spur digital care strategies more widely. So even the funders are looking at this and going, but guys, here's an opportunity that we can actually reach out and provide care in a more holistic, more accessible way to our members. Remember, the schemes are there to try and improve benefits and services to their members. They need to be recruiting these members onto their books who are happy then to pay a debit order every month. And they're embracing that. So I do think there's a strong way forwards on that one. When we talk to the schemes, I think people often say to us, will my medical aid pay for this? And if so, what must I do to actually submit my claim? I think that's the first important thing. The regulation is stating that there are some disciplines, and these are typically those from pre-COVID days, that would actually be encouraged to use what some of the schemes call dummy codes. And in the specialist space, in the doctor space, they were typically using codes, they called it a VCON-S and VCON-M, which was the text or video conversations that they'd have. And you'd actually put that procedure code, you put that instead of your procedure code into your bill. But in the allied healthcare space, and guys, please, I know that the word allied is sometimes loaded. I don't mean that in any derogatory way. What I'm trying to say is everyone except doctors and dentists. So let's say the real healthcare professionals here. that get people back to everyday function and life and pain-freeness. I think from our perspective, the schemes have typically adapted we'll pay you against your previous procedural codes that you've always used before. So there's no new dummy code or VCon rate that you need to be using in most, if not all of them. But what they are saying is that it's only appropriate for those codes that are actually requiring some form of consultative engagement rather than a physical engagement. So there is a shorter list on that. Yeah, almost I think they call it the consulting disciplines versus the physical disciplines is some of the words that they've used before. Yeah. But they've opened it up to the physical disciplines as well, because even within the physical disciplines, those that require contact with the patient, there are consulting codes within that. So it's a subset that they do then pay. And then some of the schemes will pay the full 100% of that. And others say, if it is a virtual consultation, they'll pay a percentage. They'll actually reduce that fee. And the argument goes that there's less overhead costs for you as a practitioner when engaging there. I think that argument needs to be fought. There are disciplines, 5 of them with Discovery, that have fought it successfully. Psychology being, and I must give a lot of credit to the Psychological Association, CISA. I think they've been driving really hard on that to say it's 100% and it's new patients. They were spearheading a lot of that, so compliments to them. But this now introduces a whole lot of if, buts, and maybes. Which scheme pays at what rate and why? Must they use dummy codes or not? And that's where you need to find yourself a technology partner, a practice management system that's going to bring that intelligence forward to you to make it as easy as possible. That you don't have to have 15 different Excel sheets and if, buts, and maybes and hope for the best. And I've heard from allied healthcare practitioners, they go, well, if I don't know, then I'm just going to charge everyone 75% and actually undercharge what they should be charging and what the benefits are that are available for that intervention. So find yourself a partner, I know one, who can provide this complexity in a simple way into your systems in an intelligent, easy, and mobile manner.
You had to get that in there, didn't you?
I had to get that in.
Listen, just a quick, I am mindful of the time. There's another question that keeps coming up, and that's around informed consent. How do you do and manage informed consent on a telehealth health platform?
Wow. So do you mind if I take that one, Neil?
Oh.
Yeah.
I think that's a yes.
Okay.
So, yeah.
So
is my signal okay? You can still
yeah, it is a bit glitchy. So I'll just jump in, I think, just from a regulatory point of view. So obviously your informed clinical consent, your informed financial consent needs to be in place, just like it would for any face-to-face engagement with your patient. So no shortcuts there. But there is an additional requirement, and that is that the patient consents to a telehealth platform. And there are certain terms and conditions that are related to that. So we're introducing a third one. Compliments of Elsevier Klink and Associates. We work closely with them. They've graciously made that document available to the market at no cost. We've brought that on board and commented on that as well and incorporated that into services that we offer to our clients as well. But do make sure that wherever you do get that you have a complementary informed consent, that a patient does consent to telehealth engagements. And there's complexity around that. If a psychologist is engaging with a patient, there's also certain onuses and responsibilities sitting on the patient side to ensure that they've got the privacy they're required to engage, that they ensure that their connectivity is good, and so on. So it's a two-way street there. Neil?
Yeah, and if the platform that you're using doesn't have it, in the platform, obviously on our one we actually include it. Then you need to have that informed consent. You need to get, and then of course you need to file it and keep it safe if it's ever and recorded. So yeah, but I mean obviously if you're using a platform that already has that informed consent, which is presented to the patient during the registration process, it's just a whole bunch easier. And I'll echo to Deon and say, well, I know one.
So there's 2 points. I'll quickly close on that, Lani. And the one is people are saying, what must I do differently on my claim? So I've said you kind of, in some cases, most disciplines, you can claim your normal procedure codes and you possibly could get the normal rate, sometimes a reduced rate for that. But it is very important that you include your place of service indicator. Now, if your practice management system can't do that, you need to challenge them to say, please get this in order. The place of service indicator is 02, which indicates that this is a telehealth consultation and that will be paying out of their benefits and rules that are then structured around telehealth conversations. And then at the same time, when you're submitting that, be sure that in your system, you have a robust process of measuring and managing and ensuring that you've got a track record and an auditable trail of the telehealth conversation that happened. What are your clinical notes that relate to that telehealth conversation? What texts were sent back and forwards? What time did the voice or the video conversation happen? Make sure all of that is in one place so that you can cover all these bases for future reference as you need that. When you're sending out a claim, you must make sure you've got the backing information around that, that you don't necessarily have to send to the scheme, but have ready. Now, I know some of the schemes have asked for what they call SOAP notes. Your assessments, your objective and subjective assessments in your plan. They've backtracked on that again from pressure from the market to say, but that's patient's personal information that you can't send on. But some of them do require a standard form to be completed to prove that you actually did have the virtual consultation. Be sure that your practice management system can actually provide that and supply that kind of evidence of that engagement.
Perfect, perfect. So Deon, both yourself and Neil, you've both been talking about your own individual platforms, both from an EZMed side and a Medici side. And I think, as everyone knows, these two have integrated. And at this point in time, I want to share a very, very exciting video of a testimony coming straight from the horse's mouth. Excuse me, Clint Phillips. Now, Clint is the CEO of Medici US. He's based in Austin, Texas, and still proudly South African. You'll be very glad to know. Please bear with us for a minute and a half. It's a very short video, but I do want you to just hear what Clint has to say about this exciting integration. Deon, I'm going to look at you to push play on that video for us, please.
Oh, yes. My technology, aren't you? The spot. Right, I'm going to share my screen. I think I go here. I go share. There's Clint with Madiba. Can you guys see that?
Yeah, we can see that.
My name is Clint Phillips. I am the founder of Medici and 2ndMD, two virtual healthcare platforms that are global and impacting millions of lives. I can tell you I'm a proud South African living here in Austin, Texas, and excited to just share a few thoughts. Telemedicine has become a solution for practitioners all around the world to continue great patient care and ensure uninterrupted revenue. We've seen an acceleration of the introduction of new solutions, most of which are just video platforms that don't really make a practitioner any more efficient. I can tell you that EZMed and Medici have combined the best technology that ticks all the boxes. Whether you're talking about malpractice, insurance, synchronous care, asynchronous care, and integrated practice management solution. Having had the benefit of evaluating solutions all over the world, I can confidently say that the EZMed Medici solution is the best I've seen anywhere. It's South African first and has taken the best tech, the best marketing, the best innovative minds to present a solution that will hold up against anything in the world. Really proud of what EZMed and Medici have done, and incredibly excited to see how we can improve the lives of thousands of South African practitioners and all of their patients. Thank you, and God bless you.
Thanks for sharing that, Deon.
I'm trying to find out how to stop my share here. Give me one
Stop
second.
sharing. But guys, I mean, what a fantastic testimony to the level of quality and functionality around the integration between these magnificent products, both EZMed and Medici. And I just want to remind you that come this next Tuesday, the 2nd of June, 4 o'clock in the afternoon, there will be a live demonstration of the integration. Please join us, go and register. Obviously, it's for free. You just go to ezmed.solutions. As you can see on the screen there, go to the webinar tab and you will see the date, 2nd of June. Please join us, guys. It's a first in SA, and definitely this is going to be one to remember. We are also running, and I need to just highlight this, an incredible special with regards to this integration to support all the healthcare professionals during and after the COVID period. What that means, if you're a new joiner, a new client, both the EZMed and the Medici product will be offered to you for free until the end of July. So if you're not convinced yet, join us on Tuesday. We will convince you, trust me. Guys, we have run out of time. I just want to remind you about the third webinar in our series, which is coming up next week, Thursday. Again, you can register, same time, same place. But this time we're taking a little bit of a different slant to it, and we're going to talk about the do's, the don'ts, the desks, and the dress code. Not only will Neil and Deon be joining us, but we've also got a physiotherapist from ergotherapy joining us, and her name is Karen Stretton, I hope I pronounced that correctly, who's going to be addressing how to create a dedicated space or like an office environment at home. We're going to talk about professional impressions and the sit and stand work dynamic. And I think why that is so important to address this is we've had some feedback from the underwriters, I2, about some of the complaints that they've been receiving from patients. And the type of complaints that they are receiving is about the demeanor and the unprofessionalism of the healthcare provider. Distractions in the background, a dog barking. Sorry, Neil, I had to use that as an example. But this is an informal environment. And they're getting a bit concerned about these complaints. So we just want to address it again in an open forum. Please join us. It would be lovely to, hopefully I can see your faces one day, but at least recognize the names on the list. And after all, guys, please remember, we need to practice what we preach to our patients. Myself and Deon, we're both ex-clinicians. I think, Deon, you still practice every now and again. I definitely don't. But I think that's it from my side. This webinar, as well as all the previous ones, will be posted on our website. We will collate all the questions and answer them in a document, which will also be on the website. And remember to download that checklist to see which telehealth platform you can use, which is safe, secure, functional. It's on the landing page, our page on EZMed.solutions. Guys, we hope to see all of you back on Tuesday. Remember Tuesday, and on Thursday. I think that's all from me. Deon, you, Neil, one last word from both of you.
Yeah, I just look forward to seeing more and more of you to grow this. We've kept our Zoom license to 1,000 delegates. I hope that we have to up that quite soon. And the reason being is I get calls outside of these webinars on a daily basis of people asking these questions. And we just want to have the forum where you can ask those and we can answer those to more and more people. I want to thank, I've seen again the names that have come through, various association and society representatives and leaders in the industry. Guys from the Health Professions Council, Mariette, I acknowledge you there. And it's really awesome having you all here. We want to be here to support yourselves, your associations and societies, and all the practitioners out there. And let's identify those common challenges and the common opportunities, and let's tackle those and make a difference to the patients.
Yeah, I mean, from our side, I just want to echo what Deon has said. I'm hoping that you found this to be relevant and worth it for you. It's easy for us because we've been in it for a long time, but I know it's a difficult task out there. It's daunting. We're here to support you. We're going to try very hard to put good material out on the website. As has been mentioned already, we will take the time to go through the questions and answers and post them, and we'll make very sure that we do our best to make everything relevant for you, and we are here to support you. And we'll see you next week.
Lani, one more thing I just want to remind guys of. There's a checklist that Neil has spent a lot of time on that's also aligned with the HIPAA requirements in the US, POPI compliance and digital requirements for any platform. We've put that on the website as well, so you can just go and click that and then assess whatever system, whether it's WhatsApp or Zoom 5 or whatever it is that you're looking at. Go and assess against that checklist to make sure that whatever product you do choose is compliant and appropriate for patient care.
Excellent. Thanks for that reminder, Deon. Attendees, I think we were about 545, if I'm not mistaken. Thank you very much for listening. Thank you for your time. Hopefully we'll see you next week, Tuesday and Thursday. Stay safe, stay warm, and have a good evening. Good night.